All right. All right. Again, welcome everybody. We're so excited to have Dr. Kimberly Garrett with us today, who's going to talk to us about PFAS. I know that I've talked about it a little bit, so I'm really excited for this overview, just kind of an introduction to what they are, learning a little bit more. I do have a quick announcement before we get started. I just want to remind everybody to please take the Health Council survey from our advocacy efforts from 2020, from this past legislative session. And then it also asks a few questions that are going to really equip us for those advocacy summits that we have coming up in June. So if you can please go ahead and take that form. I dropped it in the chat. We're also, I believe it went out in an email this morning as well, but we do want to hear from all of you to make sure that we make those advocacy summits as impactful as possible. So if you can please be sure to fill that out. I'll put it in the chat at the end of the session as well, so that if you want to do it afterwards. But yes, please do that, and please try to get that done by Monday. All right, I'll just go ahead and do our land acknowledgement, and then I will pass it over to Kim. The New Mexico Alliance of Health Councils humbly recognizes and acknowledges we are on unceded territory and ancestral lands of the original peoples of New Mexico's Pueblos, Apache nations, and the Navajo Nation. Together, we acknowledge the history of genocide, dispossession, colonization, and ongoing systemic inequities while strengthening and respecting relationships with Indigenous peoples. We give thanks to the past, present, and future stewards of this land and honor all nations' sovereignty. In offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, and self-governance of New Mexico's tribes, pueblos, and nations who are still here today. All right, I'll go ahead and stop sharing and pass it over to you.
Great, thank you. Hi, everyone. First, I'll introduce myself. My name is Kim Garrett. I use she and they pronouns, and I am a postdoctoral researcher at Northeastern University in Boston, Massachusetts, which is on the ancestral homelands of the Massachusetts and Wampanoag peoples. I have a background in environmental toxicology. I'm kind of a lab scientist by training, but now I work in a sociology department. And these two interests come together in my work with PFAS chemicals, which I examine from a chemistry standpoint, but also from a social and political standpoint in a type of interdisciplinary research. And so I've been working primarily on spatial analysis of PFAS detections and working with the PFAS Tribal Working Group to do an analysis of PFAS relating to tribal lands around the US, its territories and tribal lands, of course. And so that is how I met Rebecca through a talk that I gave to the Tribal Working Group about PFAS. And so today I'm just going to talk about PFAS fairly generally. I don't know what everyone's familiarity with PFAS chemicals is. So if you have a question, please feel free to drop it in the chat. I'm not very good at seeing people's raised hands while I am presenting, but I'm happy to have time for questions and discussion at the end of my talk. So I will start sharing my screen. Okay, great. So let me rearrange some of the windows on my screen real quick. Okay, great. So as I mentioned, I will just be giving kind of an overview of PFAS contamination. It's a hot topic in the news right now. They're often called forever chemicals. I will define PFAS in a slide later on. But I'm excited to get to speak to you today, specifically because a few weeks ago, the US EPA implemented the first enforceable drinking water standards for PFAS in the United States. Again, a little slide about me. I have my contact information up here. Please feel free to reach out with any questions or collaboration opportunities if you're interested, or if you just want to talk about PFAS, I'm happy to do that. And a little bit about the lab that I work for. So I mentioned it's in a sociology department, but the PFAS Project Lab studies social, scientific, and political factors related to PFAS chemicals, which are per- and polyfluoroalkyl substances. And we produce accessible, rigorous scientific research about the PFAS contamination crisis. And we really highlight our collaborations with impacted communities and just the interested public. And we do this work along with interdisciplinary researchers and nonprofits. We also advise governments when asked, not in any real official capacity, but we have some resources that I'll highlight later that we're happy to share with anyone who would like information about where PFAS has been detected and what we can do about that. So again, we share the research with impacted communities and a broad range of other stakeholders. And this research is funded by the National Institute of Environmental Health Sciences and the National Science Foundation. So for my overview of PFAS, I'll first talk about the general case of PFAS contamination. I'll talk about the chemicals, what they are, why their chemistry lends them to be really persistent environmental pollutants, their uses, how they got into the environment, and human health impacts. I'll also add a little bit of the social and political perspective to show how we got to this point. As I will reveal, PFAS contamination is widespread and pretty ubiquitous around the world. And so we want to look at the ways in which we got to this place. And then at the end, I will discuss some environmental justice concerns that reflect environmental injustice patterns overall, but are specific to PFAS contamination. And I will highlight specifically its impacts on tribal communities. So PFAS, I said that word a lot. What are they? So they are technically called per-and-polyfluoroalkyl substances. And so that means that they have many fluorinated alkyl chains, which is a carbon. So it means many fluorinated carbons in the substances. So there are over 14,000 of these chemicals. And I have two examples right here. And so in our chemical notation, we see lots of Fs. And so that stands for fluorine, and they're attached to carbons right at these center junctions. And so a fluorinated chemical is, or a fluorinated carbon is a carbon that is surrounded by fluorine molecules or fluorine atoms. The fluorinated carbons have the strongest bond that we know in chemistry. So fluorine and carbon, when they bond, they stick, and they are very, very strong. And it takes an immense amount of energy to break that bond. And so that means they last a really long time. If we think of a strong bond, we think of something that's not necessarily going to break down or break apart very easily in the environment. And so because of this characteristic, they are known for their persistence in the environment, but also their persistence in the products that we use. And they're able to repel both oil and water, which is a really unique characteristic. And so these characteristics have lent themselves very well to a lot of industrial applications. And I want to highlight these two examples down here. We have PFOS, which is perfluorooctane sulfonate. Perfluorooctane sulfate, I always trip over those two O's. But it is what's considered to be a long chain carbon, meaning that it has a fluorinated carbon chain of 6 or more carbons. And this is one of the most previously widely used PFAS chemicals until the mid-2000s, when US manufacturers said that they phased out the use of the long chain PFAS, but we'll get to that in a minute. And there's also another example is PFBA, which is a shorter chain PFAS chemical. And so when I say there are over 14,000 of these chemicals, it means there are 14,000 different arrangements of fluorinated carbons with different side chains on the end. So we have the alkyl group right there. So these characteristics of environmental persistence and those strong bonds have led them to so many uses. This is a tiny amount of the uses. This is a very small list of the uses for PFAS chemicals. They're used in firefighting foams. So again, that ability to repel both oil and water means that they can be very useful in fighting fires that are caused by oil ignition fires, because you don't want to throw water on that type of fire. They form a non-reactive barrier between the fire and the air, so they starve the fire of oxygen. And so they've been used all over the United States, all over the world in firefighting response and trainings in industries, specifically airports and airline industries use these very routinely for trainings. and also at firefighting training grounds. There's also plastic manufacturing. It's used as all kinds of things in plastics, but we think mostly of an extrusion agent. So it allows plastics to come out of molds and extruders without leaving any material behind. They're also used in electroplating, semiconductor processing, nonstick cookware. That's the big one that people hear about, is that PFAS are used in the production of Teflon, and your nonstick cookware is made with PFAS. Waterproof clothing, rain jackets are what I think of specifically. Carpeting, any kind of carpeting waterproofing spray is going to have PFAS in it. Food packaging, anything that you don't want to get oily. Dental floss, not sure why it's in dental floss, but that's a kind of famous example. Cosmetics, we think of waterproof mascara. Medical equipment, bicycle lubricants, ski wax, firefighter gear, just like it's useful in fighting active fires, it also forms a barrier between the outside environment and the firefighter's body. So they've been used in safety gear. Pharmaceuticals, pesticides, menstrual products have been in the news recently, and I mentioned those waterproofing sprays, so things like Scotchgard. Notably, the company Nick Wax does not have PFAS in their waterproofing spray. I always recommend them. PFAS gets into our environment through the use of everyday products, but the largest contributions to PFAS contamination crisis come from the facilities that produce those. Someone asks, what is it, Nick Wax? I'll type it in the chat. I think it is Nick Wax. It's you can find it at outdoor stores. It's essentially a waterproofing spray that you can use for outdoor equipment, raincoats, anything that you would want to keep dry when you're outdoors. And it doesn't have PFAS in it. Let's see. Great. So the largest sources of PFAS contamination tend to be the places where it is in highest concentration, where it's used in the highest concentration. And so we can think of industrial facilities where they're working with PFAS directly, either producing PFAS, as in a chemical manufacturer, or using it to produce a product later, like electroplating or plastic manufacturing. Military emergency training and airports are facilities that have high amounts of PFAS because of their historical use of aqueous fluorinated firefighting foam, which is that foam that contains PFAS. A major problem was that they were used in routine emergency response drills. So basically spraying huge amounts of PFAS directly into the environment, maybe a few times a month. We don't know how often those trainings occurred, but for a very long time, it was required that they used AFFF foam in those trainings. Landfills. Landfills accept industrial waste, and they also accept household waste that contains those PFAS-laden products. And so all landfills leak, and eventually that PFAS makes its way into the environment. Wastewater treatment plants are an interesting secondary source of PFAS contamination. So PFAS from an upstream source, say from an industrial facility upstream, emitting PFAS waste into the wastewater treatment plant. That becomes concentrated in their filtration systems if it gets into their filtration systems, which means you have a lot of PFAS saturated filters. And then what do you do with the filters? We still have a lot of room to grow in sustainable destruction technologies. Additionally, because of those really strong bonds, a lot of PFAS pass through traditional treatment methods unchanged, or they can be transformed into other PFAS. So sometimes if we have one PFAS that we call a precursor, it undergoes a little bit of change through the wastewater treatment system, but that change lends it to link up with another PFAS chemical and form just a different PFAS. And so sometimes you'll see the concentration of influent PFAS be lower than the concentration of an effluent PFAS. So it's a really complicated issue for wastewater treatment plants. Along with that, when wastewater treatment plants donate their sludge, so their solid kind of waste product, to farmers to spray on fields, that tends to be really high in PFAS concentration. And so that has been an issue where farmers have realized that they have farm-wide PFAS contamination, and it's led to some really unfortunate cases of economic issues and having to, oh, great, it's Nick Wax is spelled with a K, I just checked the chat. Sorry, farmers having to cull their herds of dairy cattle and basically give up farming because of this contamination. Once PFAS get into the environment, they're very, very difficult to remove. So they're very stable. As I mentioned, those really strong bonds, those weatherproof characteristics mean that they're not going to react very well in the environment. They're not broken down by the things we think of for chemical pollution, natural remediation of light breakdown, photolysis or photodegradation or oxidation out in the environment. We can't rely on those factors to get rid of PFAS. They're also very mobile in the environment, so they are carried through the water cycle, and they've been identified in global rainwater and also in Arctic ice. And you may recognize the Arctic is not necessarily a big producer of PFAS. They're also very persistent once they get into the environment. While some are carried through the water cycle, others adhere to solids and soils and biosolids, which lead to those really long-lasting high concentrations of PFAS, like on the farm. They're also bioaccumulative, and so once they get into the environment and they make their way through natural cycles, they can be consumed by fish and the animals that prey on fish and other animals that have high concentrations of PFAS. And so we see that biomagnification and bioaccumulation effect with PFAS. And so it's been identified in fish and game tissues, as well as wildlife across the world. It's very striking, just the scale of contamination that we have identified that's affecting wildlife around the world, and in places you wouldn't expect. Again, like the polar regions, we found it in polar bears, and it's unlikely that a polar bear would encounter a PFAS manufacturing facility, but it just shows how well these chemicals move through the environment. They're also very persistent in the human body. So those long chain PFAS, the ones with 6 or more carbons, stay in the body for a few years. 3 to 4 years is the human body half-life for PFOA and PFOS, which are 2 of the most well-known long-chain PFAS. There's also short-chain PFAS. They tend to stay for a little bit less time. We're learning that they have half-lives of months to weeks, but comparatively, the endocrine disruptor BPA, which we traditionally think of as a very persistent chemical in the human body, it has a half-life of a few hours. And so these are really, really long-lived chemicals in the human body. And so we don't know exactly what that means, that short-chain PFAS have shorter half-lives than the longer chain, because from what the evidence shows us, we are receiving steady state exposure. And so we're not sure what it means to have a half-life where if once you get rid of the contaminant, you get more. And we've seen this through the National Health and Nutrition Examination Survey, which we call NHANES, which is a nationally representative survey of different health and wellness factors. It has repeatedly identified PFAS in over 99% of serum samples. And so if it's in our bodies, what is it doing there? That's something that is a big area of research right now. We know that PFAS manufacturers were aware of the health impacts of PFAS chemicals on their workers as early as 1962, but this information was withheld from the public. In 2004, there was a landmark legal case that authorized the country's largest cohort study that had 69,000 participants in West Virginia and the Ohio River Valley. And that was called the C8 study because the chemical that they were studying had a carbon chain of 8 fluorinated carbons. But they linked PFAS exposure through drinking water to several diseases, including high cholesterol, ulcerative colitis, thyroid disease, and testicular and kidney cancers. And so you may recognize that 2004 to begin that study, and then 2013 to release the results of the study. That's a long time from the first recognition in 1962, but there really wasn't a lot of activity on the PFAS health impact front because that information was not available to the public until 2004. In 2022, the National Academies of Science, Engineering, and Medicine, which we call NASEM, they issued a report identifying strong associations between PFAS exposure and 4 health conditions. And they studied, I believe it was either 7 or 10 PFAS chemicals in these health conditions. So just a tiny fraction of all 14,000, but they found strong associations with decreased antibody response. So that's important in vaccine response. And so we saw potential impacts of PFAS serum levels and more intense COVID infections. They also found dyslipidemia, decreased infant and fetal growth, increased risk of kidney cancer. And finally, this year, 2 PFAS chemicals were assessed for their carcinogenicity, so whether or not they are associated with cancer, whether their exposure to them is directly associated with cancer. And they found that PFOS, which is one of those long chain PFAS, is indeed a known human carcinogen, and PFOA, a very similar chemical, is a possible human carcinogen, but they need more information. Oh, someone asks in the chat, why was this chemical ever invented? Didn't the scientists know what it would do? Yes, that is a great question. And what a perfect question for my next section. So we're going to talk about the history of PFAS. So PFAS came out of the chemical revolution, where the US military funded a lot of research into different chemicals to be used for various military activities. And PTFE, which we now know as Teflon, was one of the first PFAS to be synthesized and discovered. I don't know if scientists were aware of the long-term environmental impacts or whether they cared, is the thing. I think if they had taken the time to think about it, perhaps they would have been aware of it. But I'm not convinced that they took time to think about the environmental impacts of producing these chemicals. So all the way back in 1938, they discovered PTFE and used it for military applications, waterproofing, heat resistant, things like that. And in 1951, the chemical company DuPont began using PFOA in its commercial production of Teflon in Parkersburg, West Virginia, which is an important place to remember for the later history of PFAS. In 1956, 3M began selling its highly successful product, Scotchgard, which still exists today, and they made that using PFOS. In 1962, DuPont found evidence of PFOA toxicity in workers. One of the health studies that they conducted internally was they had workers smoke cigarettes that were laced with PFOA, and they had workers smoke cigarettes that did not have PFOA in it, and they found that the workers who smoked the PFOA cigarettes developed what they call polymer flu fever, or polymer fume fever. I'm stumbling over my words today, I apologize. And so basically it's a flu-like symptoms that occur after respiratory exposure to PFOA. And that was a highly unethical study, and I certainly hope they're not doing that today. I just think that's a ridiculous example as someone who has worked in environmental toxicology and environmental health and occupational health. Wow. So anyway, jumping forward in time, DuPont purchased land from the Tennant family in Parkersburg, West Virginia, where they were using PFOA to manufacture Teflon. They dumped over 7,000 tons of PFOA waste at that location between 1980 and the 1990s. Meanwhile, 3M did some internal health studies with their workers, and well, they did some internal studies on rats simultaneously to some studies on workers. But they identified a very specific birth defect associated with PFOA exposure in rats. And that same year, DuPont, a competing chemical company, had workers give birth to infants with similar birth defects. And so in response to that, they had all of the women who were working on the assembly lines or the production facilities dealing with PFOA, they reassigned them, which I can only hope they reassign them to an equally paying job, but I have no evidence for that. But so they recognized that health issue, but they did not alert the public. In 1984, DuPont identified PFOA in the drinking water in the town of Parkersburg, West Virginia, but they did not disclose it because they did not feel that it presented a risk to public health, or it was important for the community to know. In 1987, DuPont, still doing some internal workplace safety tests, they were trying to find negative controls to compare the blood of their workers to people who were not exposed to PFOA and PFOS. They were unable to find samples of blood that had non-detectable levels of PFOA and PFOS. So what they found was global contamination as early as 1987. Again, this was withheld from the public. In 1999, the Tennant family sued DuPont after really tragic results or really tragic impacts on their livestock that were associated with that PFOA contamination. Their livestock were sickened and died, and one member of the Tennant family documented all of this with really difficult to watch video evidence and really made a strong effort to hold the company accountable. He unfortunately died of testicular cancer shortly after beginning this lawsuit. And the lawsuit was eventually settled. In 2004, DuPont settled with the state of Ohio in the Ohio Valley for a class action lawsuit about PFAS contamination in their drinking water. And that eventually brought support for the C8 health study, which gave us a lot of the health information that we now have about PFAS. In 2005, DuPont again settled with the EPA for $16.5 million. Meanwhile, 3M paid the EPA $1.5 million for Toxic Substances Control Act violations. And through all of these lawsuits, we really became aware of this previous history where companies knew that the chemicals they were producing were making their workers sick and chose to withhold that from the public. And so we only know about the previous history that I shared because of legal discovery, specifically from the Tennant case. And you can see this portrayed in the Mark Ruffalo movie Dark Waters, which I really enjoy. I like to see, my workplace interest on the big screen. They do a really good job with that story, so I highly recommend that movie. So in 2006, US PFAS manufacturers agreed voluntarily, no legal binding, to phase out those long-chain PFAS chemicals by 2015. And it's important to note that they defined long-chain PFAS. It's a completely arbitrary designation. There's no nationally recognized or internationally recognized reason to differentiate PFAS chemicals by that 6 carbon number. So that brings us today. Oh, I'll check the chat. Great comments in the chat. Thanks. So currently, we're dealing with an onslaught of short chain PFAS. So you can imagine that when the companies said, out of the goodness of our hearts, we will stop making long chain PFAS. They didn't say anything about short chain PFAS. It turns out that shorter chain PFAS have similar characteristics to the long chains in their industrial uses, but also with their environmental impacts and their human health impacts as well. And so we're really left cleaning up after this system, which my colleague has called whack-a-molecule, which is where regulatory agencies approach a large class of chemicals one at a time. And that is very difficult because as someone who has done dose response studies and chemical impact studies, it takes a long time to declare something not hazardous. It's impossible to classify something as completely safe. That gets into the, I guess, the philosophies of science, but chemical companies really rely on the system where a chemical is assumed safe until proven otherwise. And they really rely on the difficulty of proving that otherwise. And so what we've seen is EPA and other state regulators adopting PFAS legislation, but only for a handful of chemicals or even just studying one at a time. And so that allows for a lot of these short chain PFAS to make their ways into the environments. But that means that we also have a lot to learn, and we are receiving a lot of support for PFAS research now that people are recognizing and discovering these issues in their communities. And so we've had lots of funding come through for new health studies, as well as the development of new destruction technologies and filtration technologies. That's an emerging area of study that engineering folks are very excited about, and I'm excited to learn about as well. And that leads to us improving our technology so that hopefully we can start to remediate some of the environmental contamination that we already have. But while this cleanup is happening, we still haven't turned off the tap of PFAS. So they're still being produced. We're still producing those short chain PFAS chemicals. And it's very, very difficult to do both remediation and prevention when that tap is still running. And so I mentioned that communities are discovering PFAS contamination, and it's happening all over the United States and all over the world, especially as the EPA focuses on drinking water systems to look for potential regulatory action. So the burden of demonstrating harm of PFAS, though, falls largely on the public and state governments after it's been discovered in their community. The burden is not placed on the polluters in our current regulatory system. As I mentioned, the chemicals are assumed safe until proven otherwise. And so what we have seen before is PFAS manufacturers withholding risk information from impacted communities, and they are still allowed to do that. So we don't know exactly what is going on internally with PFAS production, though notably 3M has stated that they will stop producing all PFAS chemicals in the United States, I think by 20, I don't remember what year they said they're going to do that, but they said they were going to stop using PFAS chemicals in a few years. And that sounds like great news. I hope they do. I really hope they do, but we've seen in the past that they can define PFAS as in one way or another. I always give the advice when people ask how to avoid PFAS is, I don't know if it's helpful advice, but I say, don't necessarily trust the label that says something is PFAS free, because companies can determine what PFAS are. And so if a company has a definition that they say, oh, a PFAS is a fluorinated chemical with 6 or more carbons in a row. And then they have a shorter chain PFAS that they put into their product, they can say, oh, it doesn't have any PFAS because a PFAS has more than 6 carbons. And so it can be really hard to find accurate information because of the system of regrettable substitutions. But there has been some good news. Many states have adopted regulations for specific PFAS, and some have addressed these issues through product bans, so saying we can't sell products that contain PFAS, or we can't manufacture products that contain PFAS in our state. They've also done drinking water regulations, so public drinking water systems can't have higher than certain levels of PFAS. And communities impacted by PFAS are also organizing to demand change of the system that continues to pollute. And so they highlight transparency, safety, and accountability from those polluting bodies. And so thinking about the community impacts, which have been left out of a lot of environmental conversations, we want to think about environmental justice. So environmental justice meaning the right of all people to share equally in the benefits bestowed by a healthy environment. 3M and DuPont were not promoting environmental justice by withholding all of that information from the public. They were creating environmental harm that falls differently in different communities. Oh, someone in the chat noted that last image. It is open access, so you can download it yourself too. I like that one a lot. So PFAS and environmental justice is a complicated topic to talk about because we are all exposed to PFAS, and no one should be exposed to PFAS and experience these health impacts. But even though exposure is ubiquitous, we see distribution of risk and impacts along socioeconomic status, along racial lines, along immigration status lines, and different identity and social factor lines. So PFAS sources and detections in drinking water systems were positively associated with communities of colors and overburdened communities. And our lab just published the paper writing about overburdened communities in a case study in New Jersey. And I have that linked in the references and can share it if anyone wants to read about that. Our lab also recently conducted an analysis that found about 1/2 of US carceral facilities are proximal to presumptive PFAS contamination sites. And so that's an issue when we think of incarcerated populations as underserved for environmental health and safety. We've also found that tribal water systems and the populations that they serve are underrepresented in federal drinking water testing. So when we think of the unregulated contaminate monitoring rule, which is a federal system for drinking water systems, we found that tribal water systems are underrepresented, so we know less about PFAS contamination at tribal drinking water systems. Specifically with Indigenous communities, PFAS has really rough impacts. So water contamination, of course, is a primary issue for both drinking water and other water, for fishing and where subsistence fish and game live. We think specifically of Arctic fish and seal tissues have tested positive for PFAS, and we know those are subsistence foods for Indigenous folks there. Also land contamination, again, it's really persistent. And so any contamination of tribal lands and Indigenous resources is inherently an extension of colonialism, because who is doing the polluting and who has to clean up the pollution, who bears the burden. And so this is what I think about when I engage in my work with tribal groups is this is an extension of colonialism. And there's some really good readings about pollution and its relationship to violence, and I'm happy to recommend those. But I see PFAS contamination as one such example. Another issue we see specifically in Alaska is that PFAS contamination is mostly from occupation by military forces. So in a project that I'm working on with presumptive contamination sites and known contamination sites, we find that military facilities have some of the highest PFAS concentrations, and they make up majority of PFAS contamination sources in Alaska, and specifically rural Alaska. And there is a group in Alaska called ACAT who is working actively on PFAS contamination there in Indigenous communities. And then, of course, these contamination issues and PFAS intersect with other systemic injustices. So access to healthcare and access to information about your own environment. So there is a lot to be down about with PFAS. It is a huge international issue. And as someone who works on it every day, it's easy to get bogged down with that information. And last year I was invited to write a perspective for the journal One Earth on PFAS management in the United States. And while I was crafting this commentary, I decided to write down what are all the impacts where we can have positive change. in addressing this issue. And so the results of that thought experiment are shown in this complex Venn diagram where we have the main four actors that we see having impacts in environmental contamination overall, and specifically PFAS. We have corporate activities, so the 3M and the DuPonts and the other PFAS manufacturer not changing to protect their own environments. There's also the scientific capacity, which is where I tend to work, where we need to find safe alternatives to PFAS chemicals, and they're available. And that's another huge area of study right now, is finding safe alternatives and assessing those before we put them out into the environment. So we do that through green chemistry, and also funding research into the class-based approach for regulating all of the PFAS at once. And then if they are proven safe, one by one, bringing them back. There's also the governance stakeholders who are deciding who gets funding for these different projects and deciding which cleanup activities are prioritized. And then also the communities, right, who bear the brunt of this contamination and want information about their own environment and their own health risks. And so all of these factors working together, we can take a variety of approaches, but the end goal would be a drastic reduction of PFAS use and exposure. And so when I talk about PFAS, people ask me, how can I reduce my own exposure to PFAS? And my caveat with that is individuals shouldn't have to take steps that cost money or a lot of resources to protect themselves from pollution that they did not create. But under the system that we currently have, I have a few suggestions. So the main way that people are exposed to PFAS, we found, is through drinking water. And so I recommend checking with your local drinking water system. This changes for well water. You can get testing for well water, but it's fairly expensive. So in Massachusetts, I get an annual report of the local water. I don't own my home, and they still send me this information. And I think that's really good, because I know some places only send it to homeowners. And so PFAS are listed there. And so they test for a certain number of PFAS. And I've been very lucky that we have had low detections in my water system. But you can check that information with your local water system. If you are concerned with the value that you see, or if your water system has not tested it and you are concerned, I can recommend two filtration techniques. There is the carbon filtration, which is something like a Brita pitcher, or the kind, where you have to change the filter every few months. Those remove some PFAS, but not all. They're not the most effective at removing the PFAS, but reducing any exposure can be beneficial. Additionally, there are under sink reverse osmosis filters, which I think cost around $300. So they are not necessarily an accessible solution for everyone, but they have been found to be the most effective. And there is an article about a research paper that I've linked in these slides, and I'll send the slides along, where they talk specifically about some research and the specifics of those filtration technologies. And for buying products, I cannot recommend the Green Science Policy Institute's PFAS Central consumer guide enough. I have used it myself to buy new outdoor gear that's PFAS free. They actually look into whether or not or how the companies define PFAS to determine whether or not things are PFAS free, or if they recommend them. So I highly recommend checking out the consumer guide. They have lists for clothing. I think they have cosmetics. They definitely have carpets and furniture. So if you're concerned about PFAS or other chemicals in the products that you're purchasing, you can check out that that resource, which again, I will send out. So that is all of my formal presentation. So I'm happy to take questions and hear your experiences with or opinions on PFAS contamination, and I'll check the chat again. So I have my email here and my social media handle on the artist formerly known as Twitter there. And then also, if you'd like to learn more about my group and our research, you can check out the PFAS Project Lab on our website or on Twitter. Let's see. So I will stop sharing. Great. Okay, let me take a look at the chat. Oh, great. Okay, so Sarah Jo says, we actually offer free water well testing through the environmental department. Great. That is wonderful. That is a huge concern that people have all across the country is health disparity, a rural health disparity with well water. I grew up on well water. And so I'm a big proponent of getting your well water tested.
Sarah, on that note, do you know if they're testing for PFAS?
I do not, but I know the person in charge and I can reach out to them and ask specifically. I'd be happy to. And if they aren't, then we definitely want to get it on their radar to do it moving forward.
Yeah.
Well, great. And I see your comment down below. That's great. Hydrogeologists are very important in the PFAS remediation field right now. Great. So does anyone have any questions or anything you want to talk about in the last 10 minutes? Great.
Go ahead, Gina. You're going to say something, Gina?
Yes, I want to say thank you for presenting this and bringing the topic of environmental justice. I know EPA wants to work with tribal communities as well, especially in that topic. I used to work for a university which was had a contract with Texas Commission on Environmental Quality in Texas. So we did water 2012, 2020, 2025, and it continues on. So we were working on different environmental topics that included water, air quality, water quality, and emergency response. But the challenge was always trying to get the health component with not only environmental topics, but health, because all those affected health. And like you're saying right now, this is how they're impacted our health, or impacting, I should say. And so you cannot separate health and environment. So yeah, interesting.
Yeah.
Very, very good presentation.
Thanks. Well, I'm glad to hear you say that about the environment and health. That's one of my kind of personal foundational principles, is that the health and environment are linked, and built environments are also environments. And so things that we built like PFAS contamination still impact us. I see a comment in the chat. What items are important to avoid as consumers? How can we best vote with our money? Waterproofing chemicals is before. What else is good to avoid? That's a great question. So I would recommend avoiding the things where we know PFAS is used in the highest amounts. And those are those waterproofing sprays, except for Nick Wax. They should sponsor me. I'll be a Nick Wax influencer. I know any product that you have that has kind of a waterproof barrier, Gore-Tex is notoriously PFAS laden. They integrate the PFAS into the fabric. So I tend to avoid their products, but it's very hard to avoid those. Nonstick cookware is can be an easy one to phase out because there are other options like aluminum and stainless steel and cast iron, of course. I avoid nonstick pans because I have pet birds, and it turns out that if you have pet birds, Teflon is one of the most dangerous things to have in your house, because if you leave a pan just hot on the stove, it can overheat, and that Teflon begins to break down, and it would eventually give you that polymer flue fever or fume fever. But birds get it way earlier, and it's terrible what it does to birds. They will die very quickly. So we don't have nonstick pans in our house because I love my bird friends. But yeah, I think Teflon, waterproofing sprays, let's see, blanking on several of them. Avoiding food packaging that is kind of oil resistant. If you have a greasy food and your food wrapper is not greasy, that is a little bit suspicious. See where else find it all over. I wouldn't use waterproof mascaras or cosmetics that are waterproof. You can also look at the ingredients list. This is something that I don't think gets communicated enough. Of course, they can have trade names for things, but a lot of the times, something that is a PFAS will have fluoro in it, FLUORO, which is an indicator that it has a fluorinated carbon in there. That's different than fluorine, which is the salt. And so I wouldn't say avoid anything with like fluorine in it, but if you see something like polyfluoro or, some kind of prefix with fluoro on it, that's a good indicator that it's a PFAS chemical. So checking ingredients lists for that is a good option.
What would be your thoughts on, I know like waterproof clothing is another one, or like sun resistant clothing. I've heard those as well.
Yes, and another question in the chat about ceramic nonsticks. I believe ceramic, like enamelware, I think that is Teflon free. I'm not 100% sure on that. I would consult the Green Science Policy Institute's guide on that. They might have more information about that. But yes, waterproof clothing, this gets to a question about the essential use framework, which is the idea that is the chemical absolutely necessary? So going to work every day, getting on the train, I don't need a mountaineering jacket that's coated in Teflon. I'm not paying $1 million to go hike Mount Everest, which is, I'm not sure if that's essential use either, but I'm not, it's not endangering my life to get a little wet on my way to work. And so that's a place where you can say, do I really need the intense qualities that a PFAS chemical provides? And so additionally, we found that there are lots of alternatives that we can use for waterproofing on our clothes. So I have a coat from Marmot that is approved by the Green Science Policy Institute, and it is perfect. I have no complaints about it. It's a rain jacket, and it's very nice. So it's really, I think, being selective about where you use that. If you have a very dangerous situation that you get into regularly that requires a heat proof or oil resistant fabric, then that's where we can have discussions about it's essential for now, but we will find alternatives. So I hope that helps. Oh, menstrual products, that's another like essential use kind of question. I think Diva cups are safe. I'm not 100%. I think those are silicone. Let's see. Menstrual products, the thing is they don't have to disclose all of the things that they put in the menstrual products. I think Green Science Policy Institute also has resources about menstrual products, or at least have written articles about it. I haven't looked into that too much myself. I know that the like reusable underwear have tested positive for PFAS, so I might avoid those. But that's really such a personal decision that I don't want to say, using like you shouldn't use this particular menstrual product for one reason or another. It's really a personal risk assessment or risk issue, I guess. Like if you plan on, if you are very concerned about if you're going to have kids and you're very concerned about reproductive impacts, like I would say, yeah, avoid the reusable underwear. But if you're, not planning to have kids or anything, or don't wear it all the time, then they're probably okay. But it's all kind of personal decision stuff. And I don't know of any particular products that are PFAS free right now.
Any other questions? A lot of information to take in.
Yeah. Yeah, it can be very overwhelming to learn about PFAS all at once because there are 15,000 of them. And that doesn't mean that all 15,000 are in use right now, but they could be. So stuff. But thank you, everyone. This is really nice.
Yeah, and if you want to send the slides out, we'll be sure to share them out with everyone here, same way we always do in the emails. But yeah, thank you so much. I know I learned a lot, and I hope everybody else did too.
Great. Thanks, everyone.